Okay, Bethany is back. And tell us how's so this is the third session, second
Yes.
follow-up.
Yes.
Okay, and how have you been doing?
I feel like I've been doing well. I feel like I didn't need to shovel any snow this week, so nothing really too strenuous. I did some yoga and a little dancing, and that all felt really good. Um, but I have been having this kind of like something's going up my back and feeling a little irritated.
Okay.
um, and also maybe slept on my neck wrong.
Okay.
So, who knows?
Mm-hmm.
Perhaps I didn't sleep on it wrong and
Right.
it's just something traveling up, but
Right.
I'm
So
not
getting
sure.
back to normal activity,
Yeah.
not aggravating the left side or the original pain you were here for.
Yes.
So you really have healed that really well, which is great.
Yeah.
And so now this is just more like if someone were to come in like once a month for
Right.
a routine proactive session, this probably be a lot like that.
Which does feel miraculous to me.
It's amazing. Yeah.
Like compared to what I started with.
Yeah, you were
I
really
panic.
stuck. Yeah. If things are stuck, it's really hard for them.
Yeah.
So I'll step out, I'll let you change,
Okay.
and we'll do session.
Cool.
Able to feel that the rotation that was in your spine is not there anymore. And still a little bit of tightness coming up the left side. It's residual. And that could just be baseline for you. And coming up the right side, I'm going to see if I can feel anything that feels off to me that might be creating some of this pain for you. Okay, so right there is a little speed bump. Is that part of what's been bothering you?
It really feels tight when you're
Okay.
pressing on it.
Okay. Take a deep breath here. Good. So I like to feel nice movement between the lower rib cage and the lumbar spine here with the in-breath, right? They should separate. So go ahead and do that again. That's moving really nicely. Good. A little pop there. Mm-hmm. And the next stuff you were talking about, that was right-sided as well?
Mm-hmm.
Okay. Yeah. Okay, so far nothing major is jumping out at me, which is good. I'm going to feel what your hips are doing. Okay, left side. Let your knee be, yeah, nice and relaxed. Good. So feeling the spin of the ball in the ball and socket of the hip feels really, really good. Let's come around. So I'm going to give it a little bit of a lift and a jiggle. Okay, feeling that SI joint, sacrum, a lot of good movement in there. That feels really good. And then just checking in with the tone of these deep hip rotators and the gluteal. So again, right here, where the glute max attaches to the thigh bone. This is where it was kind of swollen and congested before. It feels much better. Yeah, yeah. So, you're getting back into yoga and your normal amounts of movement, and I think you should continue that.
Yay.
That's healthy. Yeah, yeah. I mean, and considering, that it was a lumbar strain or sprain, you moved through it pretty quickly. Once we got things moving,
Yeah.
it's just such a great illustration of how important that mobility is, and how when things get stuck and the circulation sort of shuts down, it's very hard for your body to repair the tissue.
You need an intervention.
You did.
Yeah.
You did. So I've got my landmarks here is the tip of the sacrum. The sacrococcygeal joint is just to the left of my finger. And so this section here, it could be piriformis and it could be gluteus maximus, and we have to differentiate the two by the depth of the tissue and a little bit of the fiber orientation. Although the fiber orientation in the butt is hard because there's so much soft tissue. So you often can't quite feel, even on a slim person, the orientation of the fibers. But based on the depth of this, and it's pretty superficial, and it's very much like attaching to the posterior part of the sacrum. I can feel that attachment right there. That tells me that's the gluteus maximus, because the piriformis attaches to the anterior part of the sacrum. It's much, much deeper. And so if I was in this section and it was going to be piriformis, it wouldn't be this tissue, it would be that, which is also a little tight. So we're going to work this from the outside in. Nice deep breath, really appreciate that. Okay. So important to remember when you're doing this work that sometimes you do feel the muscle really let go under your hand, and sometimes you don't. And you don't have to overwork the muscle to try and get that. You have to trust, and I think this trust comes with time and experience and just seeing it work over and over again, that getting it relaxed, getting circulation through the tissues, that's what's doing the healing. And so sometimes the effect of the treatment isn't really felt for 24, 48 hours, or even longer, if the patient's older or their vitality is a little bit drained from chronic illness. So it's just good not to overwork people, their muscles, their joints, their bodies. That's good. Good. If you walked in today and I had never worked on you before, I wouldn't know that you had just sort of come through an injury. Yeah, this is like very bread and butter, run of the mill. If you pull 100 people in off the street, 100 of them have something like this going on, or maybe 99, I should say 99. Yeah, okay, good. So our next little piece here will be this left lower thoracic, thoracolumbar junction,